Hey friends, this is Ian Khan here at the Milken Institute, and I have with me somebody who's innovating in the healthcare space. Prashant, welcome to the show. I
Thank
want
you
to
for having
learn
me here.
from you. What are you working on, and why? Tell us about your company.
So Qure.ai uses AI to interpret radiology images. And we started about 9 years ago interpreting X-rays and CTs using AI. And we have sort of brought AI to the diagnostic workflow for multiple disease areas from tuberculosis, lung cancer, stroke, heart failure, COPD. The idea is that if you can use AI, you can, for example, automate a lot of radiology interpretation. And if you look at one of our first products, it was detecting TB on a chest X-ray. And this is one of the first customers. This is in Philippines back in 2018, 2019. It took them weeks to get an X-ray read because there was no reader available to read that X-ray, no
Yeah.
radiologist available to read that X-ray. And we were able to make that happen within seconds using AI. And that is how sort of we started out. That is how we said, okay, let's sort of bring AI into the radiology workflow. And that was the first product that's now scaled up, and that is one of the largest autonomous AI use cases in the world, where it is a solution which is now scaled up across maybe about 10 to 12 million patients every year, across about 3,000 sites in 60 countries, where we are autonomously reading X-rays. There is no human in the loop
Yeah.
in those reading those X-rays. So it's just a AI reading those X-rays, and we got WHO clearance in 2021 to interpret an X-ray autonomously in the absence of a human reader.
Okay.
And a second solution is around lung cancer detection, where if you know, I mean, lung cancer, typically about 80% of the cases are diagnosed late. And at late stage, lung cancer diagnosis is almost a death sentence. I mean, people don't, 5-year mortality is like 5%. So how do you bring it early? How do you diagnose early?
Yeah, of course.
And one of the ways you can diagnose early is to look at chest X-rays that are taken for routine reasons. And there are about 1.3 billion chest X-rays taken routinely as per the WHO, hundreds of millions of them in the US as well. And if you were to look at these X-rays and you were to look at scoring them on lung cancer risk, and then the most risky patients can then go and get a CT, that can really help you diagnose lung cancer early, because you are now seeing lung cancer, diagnosing lung cancer on patients who came in for a routine examination.
Yeah.
So that is the opportunity, and that is again a product that we have launched and that is now commercially scaled up across multiple geographies. And then we have other products around stroke, heart failure, COPD, again around early diagnostics and treatment, because if you diagnose early, you can treat better.
Yeah.
And that's what we are trying to do.
Of course, and this is such incredible work. I mean, this is a real example of how AI automation, AI-based anything is able to impact a person, any person who has a body, right? Like everybody has a body, so I guess everybody can be impacted by this. You know, if you take AI, the word AI, out of the discussion here, we can replace it with other words that are applicable. Let's try and simplify why this is needed. Is it because we don't have enough people who are qualified in the healthcare industry? Are the costs low for this to come in and to diagnose people and to do that? And I feel like the implications are so many. Help us understand, what are you seeing right now in addition to what you've already done? Where will this go?
I think if you look at, I mean, like you said, I mean, AI for us, I mean, what we really believe is that AI should be invisible. It's not about AI, it's about solving for a workflow for a physician,
Yeah.
right? You have to create a workflow that works for a physician, that makes it easier for a physician to diagnose a patient. And what we have seen is, one is that lack of trained resources, right? Especially if you look at outside of the US, especially I come from India, Mumbai, right? And if you look at India, Southeast Asia, Africa, you don't have enough radiologists reading X-rays. You have countries like
Okay.
Malawi where there are 2 radiologists, Liberia, 0 radiologists,
Yeah.
right? So there, I mean, if you are taking an X-ray to detect TB and it's not being read, a patient is not getting diagnosed. A TB patient is extremely infectious and infecting other people. So that is where AI comes in, can read an X-ray and help diagnose early.
Okay.
Right? And that is basically solving for a lack of resources,
Of course.
lack of trained resources. Second value proposition that AI brings in is around doing things that humans don't do very well, right? I mean, X-rays are a dime a dozen. There's so many X-rays being taken, and radiologists go through X-rays very, very quickly. And a lot of times they miss really small nodules. And the second thing is, nobody is looking at that X-ray and saying that this could be a lung cancer patient. And if you were to basically do that, it's a superhuman task to be able to diagnose or to look at an X-ray and find a nodule which is potentially at risk for lung cancer, and then triage that patient for CT. So that is again a superhuman task that AI is able to do, right?
Of course.
In many places, AI can be a scribing tool. It can basically listen to a conversation. I mean, a lot of meetings are now automatically, notes are automatically taken using AI. Doctor-patient conversations can be scribed, inserted into EMR using AI. So it can save a lot of time for a physician as well.
Of course. I remember maybe 20 years ago, medical transcription was the hottest thing, right? 20 years ago, medical transcription, where doctors could now dictate something in their dictation thing, and they would send it offshore to medical transcription companies. They would listen to that whole thing. They would type it, send it back to the doctor for notes, right? Because the doctor wants to save time. Nobody wants to do typing. Fast forward till today, right? 20 years, we are here today. Now, if a doctor is just even talking loud, you have an AI note taker that can take notes, that can categorize them, that can do magic on those notes and put them exactly where it needs to be. So one thing is for sure, that the skill set that AI brings is not about replacing a person, but it's about enhancing the process, enhancing the workflow, helping do all of that. And similarly, in the medical diagnostics and imaging industry, there's way too much to be done. There's way too much to be done. And maybe if I've read as a radiologist, I read 50 different X-rays or CT scans today, maybe the 51st, I'm going to be really tired to do the 51st. And that 51st could be so important, right? So it's about, we love humans, but it's also about more accuracy in the process, I think, which we need across the world in the medical and imaging industry. What do you see as a challenge for this? Is it funding? Is it people are not looking at the future much? They still are struggling with digital transformation. What are the barriers that you face generally?
I mean, some of the barriers that we have, faced is getting data to build this technology, right? I mean, if you are building AI for medical imaging, you need billions of images.
Of course.
And it took us a long time to figure that out and get access to those images. And you have to get anonymized patient data to train these models. So getting access to data is one of the biggest challenges, and that's why it's not a solved problem. I mean, if you look at all the LLMs they're trained on data from the internet, and it's widely available. You can basically go and collect that, right? But not for medical imaging data. So we had to partner with a lot of hospitals to collect that data. Second thing is that, again, this is important that these technologies are regulated, because again, I think of it that if you are making a diagnostic decision, you are making a decision on a patient, and if you miss something, that could be at risk could be risky for the patient. So these are products that need to be cleared by the FDA or regulatory bodies in any other country. And for us, it took us a while to figure out how to get those FDA clearances. But today we have 18 FDA clearances, and that was again something which is hard. I mean, figuring out this is basically AI to read scans is a medical device, and you have to figure out how to get it cleared through the FDA regulatory.
Of course.
Regulatory pathways, basically.
Yeah, absolutely.
Right.
What do you see the next 5 years being? If you had a magic wand, what would you make happen over the next 5 years?
I think for us, the key is how can we, one of the areas that we're really focused on now is how do you diagnose lung cancer early. And if I were to wave a magic wand, I would say I want to be able to diagnose more than 50% of lung cancer patients early using AI. And that means that more than 50% of patients will survive and will have a more than 5 year survival.
Yeah.
And that's sort of one of the wishes I would have.
Amazing. We love what you do, and it's such an incredible time for technology to partner up with existing healthcare systems and experts and doctors and different people who work in the industry to really enhance where results are going. But thank you so much for sharing those insights with us, and we wish you all the best in what you're doing.
Thank you, Ian, for having me.
All right. Thanks so much.
Bye.
Appreciate it.